If you have a painful hip with arthritis on your x-ray, one of the big things you might be worried about is, will I need a hip replacement? And the good news is that most people who have hip pain actually don't need a hip replacement, even if they have arthritis on their x-ray. Hi, I'm Dr. Dave Candy, and in this video, I'm going to tell you what things can cause your hip pain, how to know if your hip pain is coming from your arthritis or if it's coming from something else, how to know how severe your hip arthritis x-rays are, and some things you can do to get rid of hip pain, whether it's being caused by arthritis or something else. Now, if you find this video helpful, give it a like or thumbs up and subscribe to our channel so you can get notified of our future videos. So first of all, what are the causes of hip pain? Well, hip arthritis is typically felt in the groin. The ball and socket joint is actually located in your groin. It's a cup-shaped joint that's kind of faced outward in that direction, forward and outward, and there's a ball that sits inside of it. So true hip arthritis pain is actually more commonly located in the groin, not on the side of the hip and not as often in the back of the hip. Now, people with hip arthritis often do have some of these problems, but the actual structure that's causing the problem on the side of the hip or the problem in the back of the hip is usually not the hip joint itself. The arthritis, the bone-on-bone sensation you get in your hip joint is usually felt in the groin or sometimes down the inner thigh. But other things that can cause hip pain, if you're having hip pain on the outside of your hip, it's more likely a referral from a muscle, your gluteal muscles, your IT band, which is a tendon that runs down the outside of your leg. It can be caused by a referral from the L5 joint in your back, which comes down and wraps around the outside of the leg. Now, those are all different causes of hip pain on the outside. But hip arthritis is usually not the cause of the pain on the outside of the hip. Now, if you do have hip arthritis and you're limping around because it hurts to put pressure on that area, it may cause a secondary pain in the outside of the hip. But again, the hip arthritis pain itself is usually in the groin. Now, additionally, pain in the buttock, that also usually comes from your lower back or the piriformis or sciatic nerve that's in your buttock, not usually in the groin. Again, it may be a secondary effect of hip arthritis, but it's not usually caused by the arthritis itself. So the good news is if you're having pain on the outside of your hip or the back of your hip, it's a very good chance that if you don't have any groin pain, that you're probably not going to need a hip replacement. Now, secondarily, how do you know how bad the arthritis in your hip joint is? Perhaps you go to your doctor with some hip pain, and usually the first thing they're going to do is take an x-ray, especially if they don't do a really thorough subjective examination. You just say, oh, I have hip pain, and they say, let's do a hip x-ray. They may not think or have the time to question thoroughly enough as, well, is it pain in the side of your hip or pain in the back of your hip or pain in the groin? And having worked with a lot of people who have hip pain means different things to different people. Some people, describe it as pain in the groin, although not most. Most people either consider hip pain over here or back there. So if you go to your doctor and complain of hip pain, one of the first things they're probably going to do is take an x-ray. And on that x-ray, you'll see differences in the joint space. If your hip is perfectly normal, you'll see a normal amount of joint space, usually equal on both sides, and no bone spurs within the x-ray. Now, hip arthritis is graded on a 5-point scale called the Kellgren-Lawrence scale, and it's an internationally accepted scale for grading hip arthritis x-rays, or really arthritis x-rays in any joint. It can be your knee or your back or your hip. But a normal x-ray is it's graded 0, like it's equal to the opposite side, and there's a normal amount of joint space opening on both sides. Now, grade 1, usually there's some mild changes, but it's pretty close to a normal x-ray. Nothing really to write home about in any huge degree. In grade 2, you might start to see a little bit more bone spurring, a little bit of joint space narrowing, but again, not really a super big deal. In grade 3, there's definitely some more joint space narrowing, and you may have more bone spurs that appear. Now, grade 4 is really where you start to have a pretty severe joint space narrowing, and there's lots of osteophytes or bone spurs within the joint. And really, that's the grade where you might start to be thinking about having a hip replacement, particularly if you're having groin pain. Some other symptoms of hip arthritis are limited mobility, like you have trouble bending down, you just can't get there because your hip won't go, or you have trouble lifting your leg to get in the car or to step over to get in the bathtub. or you can't put your shoes on. The hip joint, when it's in a position like this, where your knees or your hip is internally rotated, meaning your foot twisted out that way, it's adducted across the midline of your body and flexed up. That puts the hip joint in kind of the space where the ball and the socket are most compacted, most narrow. And there's actually a clinical test where you put the hip up in that position. If it causes groin pain, that would be considered a positive test. Now, that's not just for hip arthritis. It can be for any pathology within the hip joint, whether that be a torn labrum or what they call an FAI or femoroacetabular impingement. But it can be any joint-related pain when you do that. And if you're having trouble, say, putting your socks on or lifting your leg to get in or out of the car, and that pain is in the groin, that might be a further indication that hip arthritis is truly the cause of your hip pain. So what do you do if you do have some hip pain, whether it be on the outside or on the back or in the groin? And the first thing you need to do is really narrow down, where is that hip pain coming from? Is it hip arthritis? Is it coming from the muscles in the side of your hip? Is it coming from the sciatic nerve or from the joints in your lower back? And if you can't find out where the problem is and what's causing the pain, then you're going to have a really hard time treating it. Now, if you do need some help to figure out what's causing your hip pain and figuring out where it's coming from and what you can do to help it, then we'd be happy to help you out at More for Life. Just click the link below here and you can request a consultation with one of our specialists, and we'll help you figure out what's wrong and what needs to be done to get it taken care of. Now, if you're looking more to try to do it at home right now, or maybe you're not in St. Louis and you can't come in locally, if you're talking about actual hip arthritis pain that's coming from the joint, there are two general classifications of things that you want to do to improve hip arthritis pain. And those are, one, maximizing the space within the joint so the ball is not jamming quite so much into the socket, and also helping to develop the muscles in the hip, but particularly in the outside of the hip and in the butt, that help balance your body over top of your leg when you're standing or when you're walking. And in fact, just doing this, standing and balancing on one leg without letting your pelvis drop to the side, without letting your knee go inward like that, are all great exercises that you can do for hip arthritis pain to prevent the ball and socket from kind of getting jammed together when you're standing or when you're walking. Now, if you're having trouble with mobility, say bending over to pick something up off the floor, or putting your shoes on, or stepping up to go up a stair, or getting in the bathtub, or getting in the car, if you're having those type of problems, then mobility stretches are things that you need more work on. So that can include just bringing your knee up toward your chest, whether you're doing that sitting or whether you're doing that laying down, pulling your knee up toward your chest. Actually doing this hip across the body where you get some impingement in the groin is a really good exercise to stretch out the muscles in the back of the hip. But you do want to be careful that you don't want to push that exercise. If you're having pain in the groin when you do that, there's no sense in just trying to pull it as far as you can, thinking no pain, no gain, because you're really just jamming bone on bone. You're going to irritate things and make it worse. So doing this is good, but just in the range that you can comfortably. Stretching and sitting like that is another exercise that kind of stretches the hip rotator muscles in the back and can give you some more space in the back of the hip so that the ball can glide back into the socket a little bit better, which you need to lift your leg up like that. The hip flexor muscles on the front of the hip are also important, because if you're, especially your rectus femoris muscle, your quad muscle that runs up and across your hip, it can create compression, and when it's really stiff, it can jam the ball further into the socket. So you want to have good flexibility in that muscle. And I've got videos on how to do a lot of those different stretches, so I'll refer you to those, both the hip flexor, rectus femoris stretch, as well as the piriformis stretches like that or like that. So there's the two classifications of things that you need, both kind of strength and balance exercises, where you're working on your hip muscles, as well as getting some flexibility so that you can move your leg better and the ball is not being jammed into the socket. Now, another thing that's been shown to be really helpful for hip arthritis is some manual therapy techniques where you actually have a therapist, particularly a manual physical therapist who's trained in that, pull on the hip and create more space within the joint. Now, that's a temporary fix. It doesn't permanently solve the problems, but it gives you enough space that you can do some of your exercises or stretches or other things that you need to do a little bit more effectively, and you get a better bang for your buck with your home program. So if you need help to either figure out whether your hip pain is coming from your hip arthritis or whether it's coming from somewhere else, or you just like to get some hands-on treatment and get pointed in the right direction, just reach out to us at More for Life. Click one of the links below this video, and we'd be happy to meet with you and help you out. And if you found this video helpful, give it a like or thumbs up and subscribe to our channel so you can get notified of our future videos. Thanks for listening and have a great day.